As director of the Pharmaceutical Outcomes Program at Children's Hospital, one of the things that I concentrate on is clinical pharmacology and the response that children have to medication. And drug metabolism, the bioactivation or biotransformation of drugs, is a critical component of outcomes that patients have as a result of drug therapy, either harmful or successful outcomes. And one example I can provide you is work that we're doing looking at the genetics of drug response for patients who consume codeine-containing products. Most of the pretext users will understand that codeine is metabolized to its active form, morphine, in the body. And there is a polymorphism of drug metabolism, a duplication essentially of the gene that converts codeine into morphine that exists in some people. So if they have a duplication of the gene, they're potentially converting twice as much codeine into morphine than others. And we think this is a particular concern in pediatrics, where codeine might be used as an analgesic, say, post-tonsillectomy in patients. And if they're inpatients and they're in an ICU post-tonsillectomy, probably this isn't a concern because they're having adequate monitoring. But if they're in the home environment getting codeine-containing products and they happen to have gene duplication, they could in fact get into trouble on therapeutic doses. The label of codeine-containing products has been changed in the United States and Canada and soon in Europe to reflect this ultra-metabolizer status that we identified first in pregnant women who were breastfeeding children, and did identify a case of death in a child that was breastfed from a mother who had this particular gene duplication. So the metabolism is a critical part of drug therapy, and one of the ideas that I'd like to suggest to my ER and ED physician colleagues is that that drug response may not be what you expect with even a typical dose. There could be many patients who have a significantly greater response to even very low doses because of these differences in human genetics. It's important to understand that. As we move forward in this science of human genetics and personalized medicine, we'll uncover many more of these differences that are likely responsible for the heterogeneity in drug response that we see today.